Next, I will talk on the nuances of handling the cunning companies. We being doctors, and it is equally true for myself also, we try to avoid such situations, but how they can trap us. So, first to start with, what are the ways to procure any instrument for your center? We can go through the tender process, or we can go without the tender process. If you are going without tender process, then you give directly a purchase order. If you are going with a tender process, then you have to give a notice inviting the tender. You have to do a technical variation, and you have to do a expert verification. This NIT is a key document, so it needs a careful preparation. And this technical specification should be non-ambiguous and specific. The tender process can be cancelled at any point without showing any reason to the bidders. And we have to make sure that at least every instrument has at least 3 bidders. In case the first one fails, the second one can be automatically eligible. So this is the dilemma. There is a tender committee for every hospital who sees the technical specifications, and these specifications are verified by an expert committee. Then we start the financial bid. The company we select. After selection, we just release a pay order, and they hand over us the instrument. So a purchase contract document is prepared covering all terms and conditions that have been agreed upon by the vendor and the hospital. The purchased medical equipment should be evaluated from 3 different angles: technical, clinical, and financial. So once the equipment comes to your hospital, we should verify the accessories, we should verify the manuals, electrical safety and operation in accordance with all applicable policies, possible shipment damage, and compliance with specifications in the purchase order. For the installation and commissioning, they are needed from the suppliers, but the in-house technical staff should also monitor this process. So where can things go wrong? If we have a substandard equipment, implants, and consumables, not honoring the guarantee or warranty, not giving the on-site repairs, charging for the spare parts or services in guarantee period, mechanical, electrical, electronic software malfunction and non-function. These are all the problems that we can suffer from. So another problems may be the direct damage due to the equipment failure, old software malfunction, replacement and reinstallation in that case when the company charges you, unsterile consumables, equipment or expired drugs or consumables and equipment delivered, creating discrepancy in bill and actual goods. All these are practical situations which we face. So what can be done in these situations? First, we have to do a written communication with the company, and we will try to solve the matter there. If it is not working, then we can send legal notice, we can file a consumer case, we can file a criminal case if the patient is damaged, we can file suit for breach of trust, and we can also spread the news on association level, digital, social, and print media. So who is potentially liable for defective medicinal products? The primary responsibility is on the manufacturer or importer of the product. If the defect arose later on in the distribution chain, such as during storage or transport or distribution, the relevant person or entity responsible for the process can also be held liable. But we have to be aware that it is a common practice for companies to indemnify themselves against potential claims by way of contract or to obtain insurance to protect against such risks. So where are the liabilities of the companies? They can be negligent, they can do a breach of contract, there can be deficiency of service, there can be breach of conditions of license, and the drugs and cosmetic rules have been amended so that the marketer of the product is also liable for defects from 1st March 2021. So how can a product liability claim be brought? The limitation period depends on the area of law. For a criminal action, in most cases, there is no period of limitation. But for a civil action, the general period of limitation is usually 3 years. And for consumer disputes under the CPA, the limitation period is 2 years. Now, where to go and to whom to go? The Drugs and Cosmetics Act allows a consumer or recognized consumer association to send any medicinal product to a government analyst and to receive a report of the analysis. A consumer can raise a complaint with the drug authorities who, after verifying the complaint, can bring an action against a manufacturer or importer of a defective medicinal product. A consumer can also approach a consumer forum and bring a consumer complaint for defective goods in the case of defective medicinal products or deficiency of services in case of deficiency at any stage of the distribution channel. The CPA clearly provides for instances in which the product manufacturer, seller, and the service provider would be held liable in case of defective goods or deficiency of services. So what are the remedies for us under CPA? To remove the defect from the goods or services, to replace the goods with new goods of similar description which are free from any defect, to refund the price of the goods along with interest, to pay compensation to the consumer for any loss or injury suffered by the consumer due to the negligence of the opposite party, to withdraw the hazardous goods from being ordered for sale, to cease manufacture of hazardous goods and to desist from offering services which are hazardous in nature, to pay such sum as determined by the consumer forum for loss or injury suffered by a large number of consumers who are not identifiable conveniently, and to require one party to pay for the legal cost of the other party. So how will you take protections? It is always better to buy insurance for equipment purchased and never deal in cash without bill for concessional rates and show in IT return and claim depreciation. So buying is an art, and be wise, be cautious, and be honest. Thank you so much for hearing.